Well, the minority in parliament is accusing government of giving Ghanaians false hope that the coronavirus situation in the country is under control. Minority leader Haruna Idrisu says government is engaged in a public relations gimmick to create a false sense of security, which is not the reality on the ground. He alleges also government is not giving COVID-19 patients proper care, and in some cases he says they are being given only vitamin C. He goes on to say that government's efforts to deal with the disease has been ineffective from start.
Couldn't we have locked down much more earlier as a country, knowing the threat? Couldn't we have closed our borders much more earlier? Couldn't we have started massive public education in local languages? Couldn't we have developed our own humanitarian response plan earlier as a country if the president's approach in dealing with this threat was one which was national in character and national informed in dealing with it? We should have had a comprehensive strategic plan in place earlier, a document we have requested without success, making us wonder if there was one. We lost the opportunity to do all this and many more because President Nana Addo Dankwa, in our view, did not prioritize combating this virus as his #1 concern. Many professionals have observed that the data being published by the Ghana Health Service does not lend itself to meaningful analysis in the form it is presented. I mean, any of you who watches JoyNews or Sky, even if you listen to the British Health Minister or holding forth Prime Minister in their brief, you can compare and make analysis out of the data made available than what is done in Ghana. What you are just told is 3,000 cases, recoveries, and deaths. That is not sufficient for any thorough health analysis. We need to know how many persons are affected, and for our view as a minority, testing, tracing, monitoring, and isolation should have been the order of the day from day one. The focus of this administration should have been on testing, monitoring, and where it is necessary, isolation. And therefore, we are disappointed at government's response to this matter.
Haruna Idrisu doesn't end there. He's calling for a full audit of expenditures on COVID-19, saying there has not been any accountability of money spent so far.
What we saw was ministries now being reduced to cooking centers. Can you imagine a ministry now undertaking cooking directly as if it was the responsibility of a minister for gender and children or a minister for Zongo affairs to set up a wache or a kinky or rice factory at the castle? You can go and visit the castle. Some of the lost cooking pots are still around the Osu castle there. This is what Nana Addo Dankwa reduced it to. Even if you spend 2 million Ghana cedis a day, Papaya standard, you should know what a vulnerable Ghanaian must be deserving of in terms of a dignified, honorable meal, and not that insulting package of food that was given out in respect of 2 million Ghana cedis. You further additionally said you needed 280 million Ghana cedis for that purpose. So shorten the period, multiply 2 million by the number of days of the lockdown, and we demand accountability for the rest of the money. No wonder we are hearing reports that PPEs are now being stolen. Who gives what to who, at what time, and who is accountable? We will not hesitate in demanding an audit into all expenditure related to COVID-19, whether the money came from internal sources or from the World Bank, IMF sources.
Joseph Opoku-Gakpo has been covering that press conference for us. He joins me. Joseph, what else has Mr. Idrisu been saying, specifically on the decision to lift the lockdown?
Well, the minority are convinced 100% that the situation with the rise in the cases of COVID-19, as we've seen, have actually resulted as a result of government's decision to actually lift the lockdown. And in the words of Haruna Idrisu, who is the minority leader, the president, Nana Addo Dankwa Akufo-Addo, did place politics above human life, and he thinks that is a very worrying situation that should not have been the case. He goes on to say that it's surprising that at the time when the lockdown was being lifted, the cases were just a few less than 1,000, but then just 3 weeks after that, the cases have gone up, and does not see how come the government is still convinced that the decision to have lifted the lockdown was a very good one. He's also been commenting on a number of issues. He's saying that the president, in taking decisions on the way forward, is not using scientific data. And in his words, the president should allow the scientists who are leading the research and doing the monitoring and tracing, and the medical experts who have more expertise in the field, to actually help him take the decision rather than allowing politics to cloud any decisions that he takes. For him, the government is creating a superficial case or a superficial situation that there is actually a reduction in the cases, which doesn't exist. And he accuses government of using political gimmicks in order to front the case in dealing with the virus. Beyond that, he's also been making a call on government to allow for Ghanaians who've been stuck abroad to actually come home. So he's calling for some form of reopening of the borders so that then Ghanaians who are abroad and are struggling to get back, for them to actually get back. And in making the point, he says that the minority will continue to do the necessary monitoring of government and how it's tackling the crisis, and as and when necessary, they will not shirk their responsibility in order to get the government to sit on its toes, even if it will mean them being accused of politicizing the whole situation of the COVID-19. So he says they will apply the necessary monitoring mechanisms, and they would also want to see some form of accountability when it comes to the expenditures and monies that have been spent in dealing with COVID-19, including the feeding that happened during the lockdown, which he says a lot of that happened without due process and necessary accountability mechanisms.
In talking about monitoring government behavior or government handling of this particular case, does the minority provide any recommendations or alternatives as to how to do this?
So that was a specific question that was put to Haruna Idrisu during the media briefing, and he said that it's not actually part of what they are supposed to do in terms of offering alternatives, and that government has the necessary data to be able to take the best of decisions. And so in terms of specific alternatives on what should be done differently, they will not be specifically emphatic on some of those, but they went ahead to make some suggestions, including what he says should be a change in strategy going forward. The minority MPs, including the chief whip, have been calling for some form of mass testing where various institutions and officials there, including the police, parliament and all, will be tested so that then the necessary tracing can be done. They're calling for rapid churning out of the necessary results as and when the testing is done, so that then it helps governments to actually take decisions on what the way forward should be. And Haruna Idrisu, the minority leader, has again been calling for what he says should be adequate treatment for those who have been infected. He claims that those who have been infected, there's a situation where when you go to the centers where they are in quarantine, they are only being given vitamin C without proper care. And he cited a situation that actually got to the attention of the U.S. Embassy and all, which he says is not good enough and wants government to invest more in treating those who've been affected. He's also been calling for adequate protection. He's been repeating the call for the necessary protective equipment for healthcare professionals. And he's been asking that due course should be applied and the law should be applied in terms of those who are allegedly stealing protective equipment. Otherwise, then they will be worrying and that the image of healthcare professionals will be damaged as people who have been involved in any possible stealing of the PPEs. He's also been responding to Vice President Dr. Mahmoud Bawumia's comment recently, comparing COVID-19 to the situation of the doomsday that the nation experienced some years ago. And he says those comments were political, and it amounted to politicizing the COVID-19 situation, which shouldn't be coming from the Vice President. He says that the Vice President repeatedly has misused data in his analysis, and so he has no moral right to even say former President Mahama is the person who has been doing some of those. So those have been some of the issues that the minority have been raising today at their media briefing on the COVID-19 situation.
Thank you. Joseph Opoku-Gakpo is Parliamentary Affairs Correspondent following that press briefing and giving us the briefing right here. So he talks about the minority calling for protection of frontline workers. We'll be doing frontline right after this, but just some of the messages you've been sending through. So after the peaking and not peaking discussion and debate, What's the point? The point is that health experts are saying it all depends also on what we do, whether or not we observe the social distancing protocols and whether or not we're serious about staying safe. Some of you have been sending messages just on that. This one says, peaked or no peaked, let's all be on our knees in prayer for God to continue to be with us in these times for Ghana to win this fight. This says, good afternoon, Gifty. Ghana Health Service is telling us we have reached the peak. Are they not the same people who told us Ghana's COVID-19 case was never going to reach 1,000? Or our case count as of today is, and you put a question mark there. You say, God save us. Nicholas sent that message. Nicholas, thank you for your message. My name is Malbeno. I'm texting from Ofankor, North Hills. JoyNews should be awarded for this pandemic for your hard work in ensuring that we at home get authentic and first-hand report on this pandemic. Anyway, okay, you say, all right, I won't add that one, but thanks for sending that message. That message actually warmed my heart. We indeed put in a lot of work, and we thank you that you appreciate that as well. Let's see if we can take one more message before we go on that break and do some front line here. This says, good afternoon, Gifty. It is so disturbing that we, the people in the Western North region, in less than a week, we are now the 4th epicenter in Ghana. The most worrying part is that we are yet to see any measures put in place by our authorities. People are going about their normal activities as if nothing is happening. We are really worried. From Gilbert in Bibiani.